Hi, my name is Jandy Rojas, and I'm an Aspen University student. This assignment is called Applying Medical Terminology. The scenario that my assignment is going to be based on is as follows. Paramedics report that patient Don Smith, date of birth July 1st, 1985, was an unrestrained driver in a motor vehicle accident about 20 minutes ago with CC pain in the left lower quadrant of his abdomen, left arm and left leg and head. Patient denies any loss of consciousness or dizziness. Vitals were a blood pressure of 165/84, the pulse was 108, breaths of 24, the temperature of 96.8, pulse ox of 98%. Splints were placed on the left leg and the left arm was in a sling. The head was wrapped in gauze and there were signs of blood. Starting in the integumentary system, Don had a cut on his forehead above his nose with a bump 2 centimeters to the right of the cut. The cut may have been from the impact of hitting something in the car accident, but the bump can also it could just be a minor injury or it can also indicate a serious brain injury. A concussion might be a possibility, or bleeding of the brain can also have occurred. A subarachnoid hemorrhage, subdural hematoma, or an extradural hematoma could be one of these injuries. Depending on the severity of the bump and the pain the patient is in, I would order a CT, computed tomography, scan, or MRI, magnetic resonance imaging, to determine if bleeding is present. The discoloration of skin on the elbow, abdomen, and knee can indicate a contusion or can also mean internal bleeding. The musculoskeletal system. Being that the patient presented with left leg and left arm pain, he was placed in splints. The pain on the left side can indicate that the impact may have come from the left in the car accident. He could potentially have fractured or broken bones. I would order an x-ray of the left extremities and also of his spine, being that he has a history of the curvature of the spine. The curvature of the spine could possibly be scoliosis, lordosis, or kyphosis. And the x-ray would just be ensuring that there's no further damage to that area. I would also x-ray his elbow and knee, being that there was a bulging of the bone almost to the skin in his elbow, and there was an enlargement of the knee. Moving on to the cardiovascular system, the patient entered the emergency room with a blood pressure of 165/84, which is considered stage 2 hypertension. This stage of hypertension usually indicates a lack of a healthy diet plan or just stress. Being that the patient's history lists the high blood pressure and high cholesterol, this might indicate that the patient might have just forgotten to take his medication or just chosen to leave his high blood pressure and high cholesterol untreated. We can monitor his blood pressure and give medication to help it come down. The patient's pulse was 108 and that's considered high. Normal range for an adult is 60 to 100. This can indicate that the patient is in tachycardia. We can treat tachycardia with beta blockers, calcium channel blockers, and or antiarrhythmics. These can help regulate the abnormal rhythm. The shock from the car accident can also spike blood pressure and pulse, but we will closely monitor and treat accordingly. Moving on to the respiratory system. I don't suspect that the accident triggered any kind of asthma attack, being that the patient has a history of asthma. But with a history of asthma, the breathing rate of 24 breaths per minute could possibly be the patient's normal range. The higher the normal number means the patient has tachypnea. This tachypnea can indicate many underlying issues, including sepsis, diabetic ketoacidosis, asthma, or anxiety. I would monitor the patient's breathing, and if we're unable to get it controlled, we can further test accordingly. A body temperature of 96.8 degrees Fahrenheit indicates hypothermia. This is an abnormal temperature. Body temperature can drop when in distress, and the stress from the car accident could be the cause of this drop. Diabetes can also lower temperature. The patient might have a lack of insulin, and that could be the cause of the low temperature. The patient's pulse ox also read slightly low at 98, but is not out of normal range for his condition and age. Next is the digestive system. The patient presented with left lower quadrant pain in the abdomen. There was also some discoloration over this area. There is a chance that in the car accident, the patient could have experienced enough blunt trauma to this area that a gastrointestinal perforation could have occurred. If this occurred, the patient would most likely have nausea or vomiting and maybe have a fever. If this is the case, emergency surgery such as a bowel resection would be required. The discoloration can indicate internal bleeding or simply just be a contusion that will resolve on its own. I would run a CBC, a complete blood count test, to look to see if the platelets might be low. This can indicate internal bleeding. I do not suspect that the patient's GERD, gastroesophageal reflux disease, was affected or had anything to do with this accident. The reproductive system. With the patient's presenting symptoms and history, I do not suspect that there were any injuries to the reproductive system. The endocrine system. Being that the patient is a type 1 diabetic, I would ensure we get a glucometer and test the patient's blood sugar. We can treat with medication where needed after the results were given. I would then find out if the kidney stones are a current issue or if they were resolved in the past. If they are a current issue, we can run an abdominal CT scan to see if the stones were dislodged in the accident. The nervous system. Being that the patient is in a lot of pain, he can be experiencing neuralgia. I would assess the patient for delirium and try to diagnose a head injury. Being that the patient had a bump on his head is a sign that he did have some sort of blunt force to the head. Cerebral contusion is a possibility because the bump was on the front of Don's head. Other injuries that could be possible include a concussion, cerebrovascular accident, or traumatic brain injury. I would order a brain scan and cerebral angiography to diagnose any significant brain injury. The patient might experience neuropathy in the future due to the damaged nerves. Being that the patient struggles with anxiety and depression, I would offer counseling and evaluate medications such as antidepressants if the patient is on them. I would also monitor the patient for signs and symptoms of post-traumatic stress disorder, PTSD. After all the tests were run, I would treat the patient accordingly and with hopes that they get healthy and they're able to be released from the hospital. Thank you.